We recently reported that certain drugs used to treat osteoporosis might increase some women's risk for fractures in their thigh bones. Well, today we're going to take a look at osteopenia, a condition that causes a thinning of the bones, though not to the extent seen with osteoporosis. To learn more about it and to find out when it requires medical treatment, we turn to ABC News Chief Medical Editor Dr. Tim Johnson.
And joining me is Dr. Sundeep Kosala, who is an endocrinologist with a special interest in osteoporosis and bone disease in general. He's a professor of medicine at the College of Medicine at the Mayo Clinic in Rochester, Minnesota, where he joins us this morning. Welcome to the program.
Thank you.
Obviously, this subject is very much in the news, so let's go right to some basics. Define the spectrum that goes from normal bones to osteopenia to osteoporosis and how we go about diagnosing that condition on that spectrum.
Sure. So in the past, the only way to make a diagnosis of osteoporosis was when a patient had a fracture associated with osteoporosis. However, with the advent of bone density testing, which uses a special instrument called a DEXA, which many women have had, you can now diagnose the disease before a patient actually fractures. So in the early 1990s, the World Health Organization convened an expert panel, and based on reviewing all of the available evidence, they defined osteoporosis as an individual who has a T-score, which is basically a score based on the number of standard deviations their bone density is below young normal women. And that T-score of less than -2.5 was defined as osteoporosis. Osteopenia was defined as a T-score between -1 and -2.5, and normal bone density was defined as a T-score above -1. So this sort of helped to categorize patients into those that clearly had the disease, those that were perhaps borderline, and those that were clearly normal.
And at what ages in men and women should this screening test be done, and how often?
So in general, in women, it's recommended that at age 65 they have a bone density test. In men, because they develop the disease somewhat later, it's age 70. However, if a woman or a man has specific risk factors, such as a strong family history of osteoporosis, or they've been on medications such as glucocorticoids that can affect bone, then the age of testing moves earlier to around age 50 or so.
And as you know, there have been a lot of critics who have said that this condition, this sort of in-between condition, osteopenia, not full-blown osteoporosis, is something that maybe the drug companies have drummed up so they can start people taking drugs earlier. What's your reaction to that criticism?
Well, I think, to some extent there may be some evidence to support that. On the other hand, I think if you look at the totality of the picture, there's certain facts that become clear. First of all, there's problems at both ends of the spectrum. So there are many patients with fractures and osteoporosis who should be on treatment, who, because of problems with access to health care, because of just osteoporosis not being thought of on the list of possible conditions, just don't get the treatment that they really need to get. At the other end of the spectrum, there's a population of women who have osteopenia who probably shouldn't be on drug treatment, and they're probably getting medications that they shouldn't be getting.
And I want to take the final minute we have left to ask you to comment on the treatment for this spectrum, and specifically about when the drugs that have been so much in the news, the bisphosphonates, should be used.
Sure. So the bisphosphonates have been around for over a decade now. There are 4 of them on the market. They're very effective in reducing fractures in patients with osteoporosis. Most of them will reduce the risk of vertebral, which is the spine, and hip and other fractures by about 50%. So for the right patient, they're very effective drugs. Now, for the vast majority of patients with osteopenia, they probably don't need bisphosphonates. They need lifestyle modification, adequate calcium and vitamin D supplementation, and perhaps follow-up bone density testing in a few years. But if a woman is losing bone at a rapid rate or has many other risk factors for fracture, then some of those patients with osteopenia could be candidates for drug treatment. I think
and
the
I'm
other point to make is the...
Okay.
Yeah.
Go ahead. One more point quickly, please.
Okay. The other point to make is that the bisphosphonates do have potential side effects, but most of these side effects are relatively uncommon, and for the right patient, the benefits of these drugs generally far outweigh the risks.
And in closing, I thank you for your time, and I'll mention that there is a website called the FRAX site, F-A-R-A-X. We'll put the address up on the screen right now as I'm thanking you again for joining us and thanking you all for joining us.